Okay, so thank you for the introduction and thank you for inviting me to speak. I have quite a task ahead of me, which is to try and to talk about the NHS England's long-term vision for community mental health services in 8 minutes. So, and what it means for carers. So, first and foremost, what I should say is that what we're about to experience over the next 10 years or more is something of a transformational change in mental health services. I think, in terms of the population, we're seeing a huge change in the demographic. People are living longer, and because they're living longer, then what that means is that people are getting more long-term conditions, and the old ideas of being an illness service no longer really work. So if you think about traditionally what we've always done, by the way, am I echoing too much? Do I need to move the mic? Because I feel like I am from...
Sounds good.
Is it okay?
Yeah, can you switch that microphone off on the podium?
Yeah. Okay. So traditional services, what we've tended to do is to wait until people become ill, and then they go into hospital, they get specialist care, and then when they're better, we discharge them back into the kind of community. The vision for the future is that we're going to look at a much more population-based, community-focused mental well-being. So it's about looking after the health of the population, thinking about prevention, and actually trying to stop people ending up in services, and then being able, when people have been into kind of hospital or had special services, having kind of much more flexible boundaries so that we can refer them back into the community to be supported. So if we think about what people need to stay well, I think this is a human issue. We all need the same things. We all need decent housing. We all need enough money to kind of eat properly and to put the heating on and to keep warm. We all need to feel safe. And we also need to feel connected, either to someone or something. We mustn't feel isolated as human beings. Isolation is one of the worst things for our mental kind of, ill health. We need to have some purpose in our lives, and we also need to feel like we've got choices and we're in the driving seat and we're in control of our lives. Probably if you think about a time in your life when you were thriving, they would be the times when those things were there. Times when you felt isolated, felt unsafe, felt like you didn't have any purpose in your life, feel like you didn't have choices, feel like you didn't have those kind of, you were in control of your life, they would be the times when you were probably struggling more. So these are absolute basic needs of absolutely everyone if we want people to thrive. That's not the only thing, and of course that won't just be enough for everyone. At times people do become ill, and in which case then people require specialist treatments. And people should have access to all treatments that we know make sense. So that's not just medication. At the moment, less than half the people who go into mental health services have access to anything other than medication. And as we've heard from Joe earlier, we know that psychological therapies can make a huge difference. I was actually on the NICE guidelines when we put together and looked at the evidence for psychological therapies, and Joe's right. We know that family interventions has got the most robust evidence in terms of relapse prevention and saving money. And yet, outside of early intervention services, I would say that less than 3% of people are actually getting access to family interventions. That's an absolutely diabolical figure, and something needs to happen. So people, not everyone wants family interventions, not everyone wants the whole range of nice concordant interventions, but people should have a choice. They should be available, they should be offered. The other thing is it's not just about those things. Yes, people need treatment, they need intervention, but they need all those things that we just mentioned 2 ticks ago. So those things as well. I'm just thinking about my background's working with psychosis. You can easily treat, you can treat someone, you can help them kind of manage their voices, what have you. But if they're then returning to poor housing, they're isolated, they don't feel safe, they haven't got enough money. Believe me, that's not a life worth living. We have to address the entire person's needs. So, in terms of the vision, I suppose, we're thinking about the whole system. The vision is one about kind of partnerships and collaboration. It's about the kind of lacking of very easily accessible kind of boundaries between communities, kind of assets and services and specialist services. So people can easily access specialist services, but they can also be stepped back down into community care. So when we're thinking about what those specialist services are all about, well, I suppose it's about access, as I say, to the full range of evidence-based interventions. So that's medication, psychological therapies, family intervention and carer support. So if anyone ever reads any policy documents and you look at the 5-year forward view for mental health, within there is a sentence and it says basically that people should have access, people with psychosis, bipolar and personality disorder should have access to psychological therapies. And at the moment we're doing a lot of work within NHS England to move beyond early intervention services and make sure that everyone has access to psychological therapies. So in terms of, that's the specialist services, in terms of community, it's about everyone pulling together. This isn't about working in silos, it's about everyone thinking about what they can offer to meet those basic needs. So it's about the integration of primary and secondary care, acute and mental health, so it's not just either mental health service or physical health needs. We're all working together, looking at things like social care, the voluntary sector, police, education, welfare. Everyone's got something to offer. And it's about recognising local assets, what's out there in the community already that will help meet people's needs. Friends and family are absolutely at the centre of that. And then we've got things like recovery colleges, sports clubs, arts activities, gardening groups, peer support, crisis cafes. This is all about bringing people together, giving people a purpose, helping them feel like they're connected to their community. We need to think about social prescribing as well. So this is about kind of in primary care, making sure we have social prescribing link workers who can link people up to things that in terms of those activities. And it's about all the stakeholders working together. So co-production is absolutely essential to this. We have to talk to people in the community to know what they want and what they can provide. And just my final slide before I go, these are going to be the buzzwords you're hearing time and time again in terms of where things are going. So it's about shared decision making and choice, supported self-management, personalised care planning, personalised health budgets and social prescribing. This is all about recognising that we have lots of individuals in the community. Everyone has their own personal needs and needs to have a kind of an individualised package of care. Okay, I've run out of time. So, any other questions? That's me.